Quinton catheters versus permacatheters, okay? Temporary dialysis catheters versus tunneled cuffed dialysis catheters. What's the difference? Here I have both catheters. Here are both catheters. This is the tunneled cuffed dialysis catheter, and this over here underneath, this is the non-tunneled temporary dialysis catheter. Okay, so what are the differences? This is the Permacath. All right, you can see it's a dual lumen catheter. It has this polyester cuff here. This is what allows tissue to ingrow into the device, keeping it permanent inside the skin. This device is a split tip design. All right, again, one lumen is used to remove blood at a high rate of flow, and the other lumen is used to return that blood back to the body after treatment. That's the main purpose of this catheter. So that's the Permacath. This is the temporary dialysis catheter, also known as a Quinton. Some people call this a Niagara. This is actually the barred trialysis, so it actually has this extra purple port here, not usually seen on most Quintons. This is an extra port that happens to be a power port, meaning you can take a power contrast injection. So for the purpose of this video, you can kind of actually ignore this. Otherwise, from that, this catheter is a dual lumen catheter. Again, has a high rate of flow, blood flow exchange used for dialysis. And the difference is that this does not have a cuff. All right, you can see that. Other difference is this is actually a smaller French size. This actually states the French size there, 12 French. The Permacath right here, this is actually a 16 French device. All right, so a difference of about 1 millimeter. But again, this device is going to go straight into the vein. All right, no tunneling. I would typically place this most commonly in the right internal jugular vein. Shortest, safest route to the superior vena cava, which is the vein that we use for blood exchange. All right, this catheter, again, similar. We place it in the right internal jugular vein, although we tunnel it, so the exit site is actually about 2 finger breadths below the clavicle. All right, this little cuff is meant to ingrow tissue into the device. All right, so this is for the long haul. You need dialysis for the period of months to years. You use this device. If you just need dialysis for a few days, you're probably going to place this device. Other thing about both devices, they can be used for pheresis treatments as well. So sometimes a patient may need, commonly for a Quinton, patient just needs a few pheresis sessions, maybe for a specific disease, or maybe they need stem cell harvesting, so they'll have a Quinton placed in the right internal jugular vein. It's placed. A few days later, they take it out, and it's done. The Permacath dialysis catheter, this is typically, a lot of times you see an older patient that just got a diagnosis of renal failure. They need a catheter for immediate dialysis, and for now and for the immediate or for the near future. So you go ahead and place this catheter and you can get dialysis for up to a year. Usually at that time, a plan is made for that patient to get a more permanent dialysis access, which is a AV fistula or AV graft. All right? So that is the difference between Permacaths and Quinton catheters. Again, tunneled cuff dialysis catheters versus temporary dialysis catheters. Hope this video was helpful. Sir RMD, thank you for watching. Take care.